Hello. Welcome to Primetime Live with Next Level Prime. This is episode 1 of a monthly series where we're going to talk about all things Next Level Prime. I'm your host, Dr. Karen Rakers, Chief Medical Officer at Next Level, and I'm a family medicine physician. I have been with Next Level for almost 9 years and have had the absolute pleasure of managing the Next Level Prime program for the last 2 years. You guys all might be wondering, who is Next Level and what is Next Level Prime? Well, today I am thrilled to have Dr. Juliette Breeze, CEO and founder of Next Level, on the program, and we're going to talk about that. So, Dr. Breeze, welcome to Primetime Live.
Thank you, Karen. This is a cool platform. I'm excited to talk to you today about my absolutely favorite subject.
I love it. Well, we'll go ahead and jump right in. I would love to hear your description of who is Next Level and Next Level Urgent Care.
Well, at the risk of boring those who already know us well, I'll give you the very short version of our sort of origin story. Basically, I ended up in a freestanding emergency room with a child on the weekend and got a big bill and got mad. So decided there's got to be a better way for the people of at that time, and we were just in Houston, but at the people of Houston need an option that is affordable and easy and good quality medical care that is open on the weekends and after hours, so that we are not all using the emergency rooms for things that aren't emergencies.
Absolutely. Such an important, thing to offer our community, right? Like people don't know where to go when their PCP is not open, and we definitely don't want to wait in a long emergency room line or pay those emergency room bills. So now I think you're about 10 years old as an urgent care company, and I know there's been a lot of change over the years. Over that evolution, at some point, the Next Level Prime idea and concept came about. Tell us about how that came to be.
Well, this is the part of the story that gets kind of exciting, because we were open as an urgent care. We were doing good work, and I love the fact that we're available for people for acute needs. But as things evolved with my business, first of all, as a business owner, we had a lot of employees. And one of the most expensive lines on my, for my business, one of the biggest expenses is healthcare. And I started thinking about that. Boy, I'm spending a lot of money on, health insurance for the people that are working at Next Level. And I think that would have been fine, except that I often got complaints and little comments from our employees about how they wish that they didn't have such a high deductible, or they wish that they didn't have to pay a copay every time they went into a doctor's office. And I realized that for all the money I was spending on insurance for my staff, they didn't really feel like they had great coverage. So that was bothering me in the back of my mind. And then, COVID happened, and we started hearing about all of these people who weren't going to the doctor anymore, who were avoiding the doctor's office for a variety of reasons. And so I just started thinking, God, we have all of these facilities around town, and what if I could use them not only for urgent care, but what if I could provide basic medical care, primary care, preventive care, lab, the things that people need most of the time in healthcare? What if I could provide those for people also? And I loved the idea of a membership, because I really dislike the fee-for-service model. I don't think it serves patients well. I don't actually think it serves physicians well. The fee-for-service model forces doctors to make patients come in for care because it's the only way we get paid. And so I just started thinking, after all of the things we learned about different ways of practicing medicine, video and chat, and the things that became popular during COVID, why aren't we using those more often? And it really had everything to do with the way that the economics of medical care. So all that to say that what we decided to do is on January 1 of 2021, we launched a membership model for our own employees. And what we did was we sort of paid in an amount of money every month to cover them for basic medical care. And it was awesome. Our employees got their care unlimited for free for the basic things we do: primary care, urgent care, telemedicine. We added some mental health counseling. We added health coaching. We have the central lab and x-ray. So all of those things that our employees do and need for their children and for their family members, that was all free to them for the membership that we paid ourselves. Well, that's really great. We did it for ourselves, and boy, it saved a lot of money. We ended up avoiding a lot of emergency room visits. We ended up doing things that we were just, amazed at. Our stop loss carriers charged us less because we were keeping so much in-house and not sending to specialists and avoiding hospitalizations. And so it was exciting, but what ended up happening that was even more exciting was that, we decided, why don't we allow other people to take advantage of this model? And so Prime we piloted it on ourselves, and then we released it to the public, and we are adding employers all the time. It's been really exciting. And I'm really happy to say that we're not the only satisfied customer. So now we have a lot of satisfied customers.
I love it. As a primary care physician, hearing about that team approach and having all of those different components accessible to the patient, it's so important. And I think, the fee-for-service model, could not agree with you more. Practicing primary care on my own in the past, and dealing with, insurance companies and that fee-for-service model, you just realize, there's kind of a barrier between, you and the patient. It's that middleman, and cutting that out, I think is so critical.
And it's a big cost saver because, we spend so much money on getting a claim paid. And that's ridiculous. The money should go, if people are going to spend money on healthcare, it should go to care. And so that's what we're trying to do, remove all of the things that aren't medical care from the medical visit.
Yeah, I think we're one of the only industries where you have such a big middleman. You don't go to, even at the car dealer, you have car insurance, but you pay your car dealer, you pay for service on your car directly to the person giving you the care. It's not this roundabout way. So
that's exactly right.
I love it. Well, tell me a little bit more about, what sets Prime apart from a traditional healthcare model, in addition, I guess, to what we've already been talking about.
Yeah. There's several things. Traditional healthcare happens from 8 to 5, Monday through Friday, in a doctor's office, where the doctor doesn't really want to talk to you on the phone or on any other manner except for having you come in. So what we did was we blew that wide open. We said we're open 7 days a week. That was our model from the beginning. We are open in person 9 a.m. to 9 p.m., but we added a layer overnight. So we actually have medical providers available 24/7. So, people can get on a virtual appointment even after hours. And at least they can get the medical care. So, one of the things that is so confusing about healthcare is, even as a physician, I took my kid to a freestanding emergency room because on a Saturday, I didn't really have another choice way back in 10 years ago. Imagine, people with a lot less understanding of the industry trying to figure out, do I take my kid to CVS? Do I take them to an urgent care? Do they go to their regular doctor? Do they go to an ER? It's really, it's hard to understand how it all works. And so we have something called Care Navigators, and they are available push of a button for our members, and they're available 24/7 to help people with those questions and help navigate them to the appropriate place so that they're not making the wrong decision.
So confusing. I, again, will go back to my days of being a primary care, provider on my own out in practice. it would be, I was astonished all the time at the decisions that patients would make about where to go and seek care, because I would have people walk through my door at my primary care office with crushing chest pain. And then the next day, someone with a sinus infection would go to the emergency department. And patients, it is very confusing. I don't blame any of them for not understanding where they should seek care. But this sounds like a great way to help people. They're always available. Next Level Prime, push of a button. Hey, I need help. I don't know what to do. And they get the help that they need to figure out where they need to go.
That's right. That's right.
Okay.
So proud.
Well, what about the employer side? So what should they know about Prime?
Well, I think what they should know is that we have capped their expenses. So there are several ways that you can get healthcare as an employer. A more and more popular way is to be what we call self-funded, which is that you have a card from a carrier and you have access to their discounts that they've negotiated, but you are actually paying every single medical bill that comes through your doors for your staff. When you are in that circumstance where you are a self-insured employer, you have no control over what your monthly payment is going to be, because you don't know where your patients or where your staff are going to choose to go, and you don't know when they're going to get sick. What we've done is taken some of that scariness out of that situation. We say, look, depending on how big of an employer you are, we have under 100, we are doing $75 per employee per month. Over 100, it's $60 per employee per month. And that covers the employee and their family. And for that employee or their family members, they never take their wallet out in our centers. So as an employer, you get the comfort of knowing that 80% of what your staff are going to be going into the doctor for, you've already paid for. It's already covered in what we do. And then for the 20% of things like accidents, surgeries, hospitalizations, you should still have some sort of high deductible coverage that they can access. But you can save a lot of money layering us with something like that.
Yes. Well, and also knowing that you have that care navigation piece also. So if people do need care outside of that 80+%, that they're going to help be assisted in finding places that are in their network that'll still, again, be lower cost for the, on the back end for that self-insured employer. So
that's right. Well, and I also want to mention another thing, which is it's very important to employers, because it was very important to me, is staff retention, because we are in a pretty competitive labor market. And I know a lot of employers out there, a lot of my friends who own businesses, they want to make sure that their employees can, think that they're working at the best place they can work. Yeah. So giving people free healthcare is a big satisfier. We have had a retention rate, an amazing change from going in 2019, we were at about 22.7% turnover rate with our staff. We're down to about 12.8% since implementing Prime. Yeah. I mean, I have employees come up to me all the time and thank me for Prime for them and their families.
Such a great benefit. I mean, who could not want free healthcare? Timely, one of our viewers just asked if a group can participate with us. And I think we definitely spoke about that. Employers and groups definitely are the people that we're targeting for this particular program right now. So sounds like an amazing program. Obviously, it's free. It's great access. Self-funded employers get to have controlled cost. What are some of the success stories that you've seen so far with some of our partnerships?
Well, I mean, there's two kinds of success stories. There's the money-saving success stories, which we get on a regular basis. We have a union which that started with us just recently, and they're seeing about a $30,000 a month decrease in their ER spending, which makes me happy. That's one of the things that we can do pretty much right off the bat when people institute these programs, when your employees know that they can go for free to somewhere that is open pretty much around the clock 7 days a week, you will see less ER visits guaranteed. And so that's a really nice cost savings. But some of the other things that I think are pretty exciting are honestly great success stories with we had an employer start that had a manufacturing company, and they were having nobody go for their annual physicals. It was a very low turnout for annual physicals. We put this program in place, and we do a lot of outreach and encouragement. We want to engage patients. We want patients to use this healthcare. This is part of the magic is, that we are very incentivized, and I'll talk about that a little later, to get people to actually use the program. Anyway, they have had a phenomenal increase in the number of patients that are their employees that are coming in for physicals. And one of the things that I'm noticing is that they're doing a lot of those physicals on the weekends and in the evenings. And that was just something that wasn't available to them before. They want to take care of themselves. They can't take off of work for that.
Yes. Unheard of, though, to be able to get your annual physical on a weekend.
Yeah.
I mean, or at 7 p.m. on a Thursday.
I'm not aware of anyone else doing that.
Yeah.
The other thing that we're doing, which I think is very important, and I'm very pleased with this aspect of our program. We are believers that you can't be healthy without looking at both physical and mental health.
Yeah.
And we have included behavioral health counselors as part of our program. We do address mental health concerns in our visits. We treat anxiety and depression and attention deficit and all of these things that people come up against in their daily lives. But we also have very short-term, bursts of counseling available for people so that they can get on top of things that are causing them distress in their lives. Also, it's not very much fun to get diagnosed with a chronic illness, and we offer people some coping skills and some things that they can work on to make them more resilient when they get a diagnosis that's not all that great. So that is part of the program, and I am pretty pleased with the fact that it is a highly utilized part of the program. We, as fast as we can put additional counselors in, their schedules fill. And I think that just, it speaks to something that's happening in our community and something that I'm very proud to be part of fixing.
Absolutely. I think mental health issues took such a spotlight, during and after COVID, and bringing that into this type of program is just critical. I mean, having the access to mental health is so important. It's a struggle for people to have access to counseling, psychiatry. We're kind of grouping all of that here into this program, right? Mm-hmm. All together at, again, no cost. So any other benefits for employees you can think of? I think we talked about some of them. Anything else you can think of that you want to touch on for?
Sure. I mean, our health coaching is also pretty exciting. Yeah. And I will tell you that I'm going to give a little sneak preview of what's to come.
Yes.
For no additional cost, we are working on a major upgrade to our platform, which will be launched here in the spring. But it's going to include the opportunity for patients to actually use a facial scanner and check their stress level, their blood pressure, their oxygenation, their heart rate right from their phone. And then they can alert us if they're having issues. And that's pretty exciting. We are also launching chat for our patients, so they don't have to come in. They can just message us and let us know what they need. There's even something it's even more cool, which I think is going to be the next wave as we move away from fee for service and we get into membership and value-based programs. We are actually launching a limited self-service module. Basically, it's called Can I Skip the Visit? Yep. And if people want to take themselves through some algorithms, if you have a basic medical need that is very straightforward, that really doesn't need a visit, but you've been made to come in the traditional model, we might not even make you come in for that. So, if you have seasonal allergies and you always get an albuterol inhaler and it helps you get through, that is something we don't need to make you, come in for that. So,
I mean, I will just say that's taking the convenience level of this program to the
next level. Yes.
I love it. I love it. The technology piece is key. I think hopefully patients will really appreciate that component of it. I think it's going to be so easy for the members to use that platform. So, will Prime ever be available to individuals?
Well, thanks for asking, Dr. Rakers. Actually, we just launched a limited pilot. We are offering Prime to individuals. It's a little bit of a different program because some of the membership has to be paid up front, because we have a harder time getting individuals maybe to be to get payments in, and unfortunately we have not figured out how to do this for free yet. So we are excited about the individual program. We believe that this will be something that people can use for themselves and their families, and we launched it as a pilot because we just honestly don't know what we don't know. We're trying to figure out, do people want this? Will they use it? How much will they use it? Is it different for us to offer it to an individual versus an employer group? Generally, we find that, if we get a group, then we have a lot of opportunities to get in there and engage. And so we're going to learn from this pilot that we've launched. And if you're interested and you're listening to this, jump on our website. We actually have a whole FAQs about going with Prime as an individual.
Yeah, I think we've seen too in our urgent care setting so many patients coming in and saying to us, can't you just be my primary care provider? And so I guess this now is that opportunity for some of those people who want to take advantage of that as an option with us.
That is true. We actually limited the pilot to a 100. So when we get to 100, we are going to close it down for now and just run it sort of as a research project, and then we'll decide what we want to do with that.
What other deep thoughts do you have to share with us about Next Level Prime?
Deep thoughts. I think really what I would love to say is just that a lot of people say there's no way, this is too good to be true. There is no way that you guys are doing a membership for $60 that might cover a family of 4, and for unlimited all of this care. And what I will say to that is, I think we've been conditioned as a population to believe that healthcare has to be really expensive. And that is just not true. We have made it expensive by the way that the model that we've used. And we have employ an army of people to get process payments. And that just doesn't make any sense. So I hope that there are some employers out there that are interested. We already have about 23,000 members, but we have room for more than 100,000 members. So we're very excited about getting out there and just having employers try us and realize what they could be doing for their employees.
Terrific. Well, I have another question that popped up in our comments. How about a relationship with a large medical specialty group?
That's actually something that we are hoping that this is an evolution. So we are starting where we know we can do, because we're already doing it. But I would love to ultimately, move into getting specialist second opinions and specialist care, and really making this an integrated system. Right now, we're starting with what we know we can do, because I don't want anyone to start making this more expensive. I really want people to be able to get a really great value for their money. And so that's where we're starting. But yes, sky's the limit. We know that there's a lot of opportunity out there to make this better over the years.
Absolutely. Well, I don't see any other comments or questions in our chat. I think we'll go ahead and wrap it up. Thank you again, Dr. Breeze, for joining our first episode of Prime Time. We'll look forward to launching once a month in the future. And hopefully everybody will come join us in a month.
That was an honor. Thanks for having me,
Thank
Karen.
you so much.
Bye.
Bye.